Thank you, Madam Moderator. Good to be here. President Ha, Director General Lavater from the International Hospital Federation, Excellencies, ladies and gentlemen, dear colleagues, dear partners, dear friends of global health. It is a great honor and privilege for me today to open this ceremony of the Dr. Lee Jong-wook Memorial Prize for Public Health here in Geneva on the occasion of the World Health Assembly. We gather today in a place and at a moment that truly matter. Geneva, we all know it, is a special ecosystem, and there is certainly no better place than the campus biotech to exemplify the richness of this ecosystem. It is a unique crossroads where knowledge, commitment, collaboration, multilateralism, and responsibility converge in the service of global health. At the heart of this dynamic is the Geneva Health Forum, which we co-founded together with the University of Geneva and which proudly celebrates this year its 20th anniversary. Since 2006, the GHF has become a living, inclusive, and neutral platform bringing together stakeholders from across sectors, policymakers, academics, healthcare professionals, civil society, and the private sector to exchange ideas, challenge perspectives, challenge sometimes the status quo, which is always a good thing, and above all, to build concrete solutions to global health challenges. And in an increasingly fragmented, polarized, and tense world that sees multiple geopolitical shifts, unfortunately, this ability to connect, to build bridges, to bridge divides is not just invaluable, it is absolutely critical. It is a clear condition for progress. The ceremony that brings us together today embodies this very spirit. The Dr. Lee Jong-wook Memorial Prize, established in 2008, recognizes outstanding contributions to public health, particularly those that serve the most vulnerable populations. It bears the name of a leader whose vision, and we've seen it, remains deeply relevant today. A vision, a very simple vision, a vision of health for all, without distinction, without exclusion, without discrimination. Dr. Lee Jong-wook embodied a form of leadership grounded in equity, access to care, and collective responsibility. His legacy continues to inspire us and also to challenge us. I would also like to warmly acknowledge the commitment of the Korea Foundation for International Healthcare, the KOFI, which sponsored and sustains this prize. Through its work, KOFI actively strengthens health systems, supports medical education, and promotes sustainable international partnerships. It reflects a powerful conviction that global solidarity and cooperation are indispensable to reducing health inequalities around the world. The laureate we honor today, Professor Mohammad Abdul Faiz, perfectly illustrates this commitment. His work on snake bites envenoming reminds us of a reality that is too often invisible, the burden of neglected tropical diseases that affect millions of people, particularly in the most vulnerable regions of our planet. For many years, underestimated snakebite envenoming was recognized in 2017 by the World Health Organization as a high-priority neglected tropical disease. This recognition did not happen by chance. It is the result of years of research, advocacy, and field engagement to which the Geneva University Hospitals and the University of Geneva have actively contributed through long-standing projects in Africa and in Asia. This reminds us of something fundamental. Progress in global health happens only when science, field experience, and institutions work in collaboration, work hand in hand. This approach is central to our mission. At Geneva University Hospitals, we are deeply engaged in this collective effort in close collaboration with WHO, notably through our WHO collaborating centers. We have 6 of them, and we cherish them, and they contribute in very concrete terms to global health and to the collective effort. They contribute to international standards, to guidance, and to sharing and spreading expertise across geographies and hierarchies and across borders. But beyond structures and institutions, it is above all a set of shared values that unites us: scientific excellence, ethical commitment, and a deep determination to serve those who need care the most. Today, the challenges we face are immense. Inequalities persist. Crises, health, climate, humanitarian are multiplying and are deepening. Health systems are under extreme strain and pressure, and yet, there is also reason for hope. Never before have we had such knowledge, such innovation, and such capacity and potential for collaboration. Never before have the connections between global decision-making and field realities been so critical. This is precisely where the Geneva Health Forum plays a vital role, by bridging the gap between global policy discussions and real-world health challenges, helping to turn dialogue into concrete action. The prize we present today is a powerful message, a message to each of us that individual commitment can have global impact, that perseverance in science can shift international priorities and shape the global health debate, and that the health of the most vulnerable must remain at the center of our analysis and at the center of our decision-making. Allow me to conclude with a wish. May this moment be not only a celebration, but also a source of inspiration. May the journeys we honor today encourage us all to go further, to innovate, to collaborate, and to be bold. And above all, to never lose sight of what unites us, the profound conviction that health is a common good, health is a public good, and a fundamental human right. Thank you very much for your attention, for your commitment, and I wish you all an excellent ceremony.